The Black Mental Health Response Team is a team of BIPOC and culturally competent individuals who provide services from all different areas of the mental health field, whether it be peer services, mental health counseling. We also have spiritual support. We became about right after the 514 Thompson Massacre shooting. Lord, we thank you for the After the shooting, initially there were no counselors of color who showed up to respond, and there was outcry from the community stating that they wanted people who looked like them, especially because this was a racially motivated attack. We didn't know who we could trust at that time. So BestSelf did have the capacity to provide Black mental health leaders, peers, and counselors to help provide support during that time. So we were at Johnny B. Wiley, Meriwether Library right on Jefferson, as well as the Resource Council on East Ferry. It was a really good turnout. You know, people really just didn't know what to do, where to go. Everyone was kind of lost, and it really brought a sense of community for everyone, not even just the participants, even for us who was working, because we really had the chance to really lean into each other and really be vulnerable in a way that we probably haven't really been in the past. A lot of it is the trusting process. You know, as people of color, we've gone through a lot within this world, and sometimes representation really just doesn't matter. You know, it's not really talked about a lot growing up in a Black home or Hispanic home or any person of color home. You know, we don't really talk about mental health growing up. We kind of sometimes bottle things in. We have to stay strong no matter what. We have to, still push through and work through regardless of anything. So sometimes it's good to just have someone who can understand that from a racial standpoint of, we have a lot that we carry outside of just being human. Right after the shooting, BestSelf did a really good partnership with the Office of Mental Health, and we all really came together with crisis services and other service providers to provide the services. And Reimagine I Am the Change was also then born, where they also provided funding to smaller agencies or grassroots organizations to help continue this work in a non-traditional way. Hence why we do not charge for any of our services. So when our clients come to us, they're getting what they would get in a clinic in a non-traditional way for free. We're able to continue providing these services because we are now entering our new grant, which is the Recast grant, which focuses on at-risk youth and families. Our youth, they're the next us, when it comes to the workforce and just life, period. So, really making sure we're pouring into them, giving them the support that they need, because a lot of times, again, we're not talking about this as we're growing up to then be able to deal with this in adulthood. Having that support behind them with their families being involved, it just creates a better system all around. We really just want to make sure that we're tackling the full system and not just pieces of it. I think a lot of it starts from before even schooling. Some people can't afford schooling. There's also a barrier there for the Black community, not having the support to do so. So even just finding non-traditional ways of, making sure that people of color have access the same way that others do. Whether it be changing our certifications or, providing more trainings and, expanding what the credentials will look like for these types of roles, or creating these non-traditional roles. So that's why we've even brought on spiritual counselors. Normally that's not something you would see in a clinic, but it's really important because it is a very connected piece to the Black community, religion, as well as, it gives opportunity to people who don't have possibly master's degrees and things like that to still be able to engage with the community in a healthy way. The need for Black counselors is really big. Our voices are being heard now, so it's time for us to have our seat at the table.